Hello, good afternoon. My name is Saffa Gobba, a student of the University of the People and the Department of Health Sciences, studying an undergraduate degree of Bachelor's of Science in Health Sciences, a final year student. I'm here today presenting my Capstone project, a 10 slide PowerPoint with a capstone topic of an epidemiological study or investigation of under 5 years old children malnutrition in Sierra Leone, Kenya district. My student ID is S241295. So, the reason why I choose an epidemiological study investigation of under 5 year old children malnutrition in Sierra Leone as a Sierra Leonean and in Kenya district is one of the districts with the highest malnutrition rate within Sierra Leone. So I decided to choose this capstone project to see how best I can develop an entire project and see how I can help in salvaging the malnutrition problem of my dear country, Sierra Leone, at the eastern region, especially where I am coming from. So the introduction of this capstone project, as I have said, Kenya district face a severe public health challenge with a high rate of acute and chronic malnutrition, especially among children under the age of 5 years old. As the malnutrition rate within Kenya district is the highest within the country and is also above the WHO emergency threshold. The activities involved in Kenya district is a minerals area, people practice agriculture, and also it's a business-oriented district. So the purpose of this capstone project is to identify the social, economic, and health factors that are related or directly contributing to malnutrition and provide an evidence-based recommendation for intervention. So, in the literature review, nearly 500,000 of children under the age of 5 years are having stunted growth in my beloved country, Sierra Leone. And 30,000 suffer from severe acute malnutrition. Among these 30,000, Kenya district is having the highest. So 38.7% of children in Kenya are having stunted growth and 12% are having muscle wastage, which is a total of 50.7%. And the most contributing factor to this malnutrition in Kenya district are poverty. As you say, most of the population among the people living in Kenya district, especially those living in the rural area, can't afford a normal meal per day. They live below the standard of living for a day. So, with this particular strain, they hardly get what to eat. And food insecurity, as the planting season approaches, we see large quantity of food. But as it's fading away gradually, there is hunger crisis within these communities. Because when after harvest, they don't measure what they eat, so they eat until they eat everything that has been reserved and only remaining the seeds for planting season again, which they can't eat. So this is mainly contributing also to the food insecurity and indirectly linked to the poverty. And the poor dietary diversity, the cultural taboos, as in our community, especially in the Kenya district, the cultural taboo, for example, kids don't eat eggs because according to our cultural taboo, we end up being thieves. And even pregnant women, they don't allow them to eat some meat or neither much proteinous food as their kids. As the saying goes, the kids will be thieves or the kids will lack some developmental delay. So with this, all these are contributing factors. So the policy context of my capstone project is to have a national plan such as Sierra Leone National Development Plan and multi-sectoral plan for reduction of malnutrition highlight nutrition as a development priority. So the framework for the capstone presentation is the study will use a right-based participatory framework engaging local authorities, tribal leaders, and health workers at all stages. Why are we using local authorities? People have trust in their local leaders. So, and people have trust in their tribal leaders. Every tribe has a tribal leaders, and we have our local authorities. By involving them, helping them understand what the research project will be, will help greatly in this capstone project. Because when you tell them what the project is, you allow them to own, they will participate actively. And when they participate actively, the people in the community will trust whatever is coming from their tribal heads. All ethical principles are going to be observed, that is no malice, there will be no injury, social justice will be respected, and autonomy, especially also for research involving children. So all ethical principles will be observed. And national alignment, how this project, Capstone project, is being aligned with our national need. As the research aligns with national and national policies and the SMART, which is standardized monitoring and assessment of relief and transition. It's a methodology for nutritional assessment within the country. It has once been used in the Sierra Leone Nutritional Survey. So we're going to use and see the data. We compare the data from 2021 and that of 2025. So data analysis. So the study design is a community-based cross-sectional study by using the SMART methodology and a two-stage cluster sampling in 15 villages. So Kenema district has 15 chiefdoms, and each of these chiefdoms is going to be represented in this research project, which will provide a baseline analysis of the spread of malnutrition within the district. And the data collection, we are going to use anthropometric measurements, which are the weight for height, which is commonly called the Z-score, and the MOAC, the mid-upper arm circumference, which is the MOAC. Household survey on the diets that are available, and also the educational level of the caregivers and those in the home based on malnutrition. And also we'll check the health service. How are these health services accessible to these people? Remember, Kenema district with a high population has all 130 health centers, which is not enough to provide health service for the target population. So this alone can contribute to the malnutrition rate within the district. And how are these data going to be analyzed? We stratify prevalence rate by cluster, sex, and age, and multiple logistic regression to identify risk factors such as maternal education and household insecurity. So summary of the entire findings. As earlier on said, Kenema district has a high prevalence of malnutrition with a stunted growth rate of 38.7 and a most early stage of 12% among kids that are below the age of 5 years old. And the key determinant, as earlier explained, are high poverty rate, food insecurity, poor diet and diversity, as most people believe feeding on carbohydrate is the best practice within Kenema district. And low maternal education and limited healthcare services. The service gap, limited access to therapeutic food, which is the food necessary for malnourished kids, which is not easily available, even within the available health services that are within the district. And ethical consideration, community development, confidentiality, and cultural adapted consent as a process. And in general, the conclusion, malnutrition in Kenema district is driven by complex interrelated factors requiring integrated multi-sectional intervention. The study findings support targets improvement in maternal education, dietary diversity, healthcare access, and community-based nutritional program. As most of our mothers are less educated, it's another research point. My recommendation is strengthen health and agricultural assistance, improve nutritional education, and enhance resource allocation for sustainable impact. These are the reference pages where most of my notes have been taken. So, thank you very much.